Welcome to the Codecast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast Podcast. Today, my name is Terry Fletcher. So I know it is not quite the last Tuesday of the month, but I have been a little bit remiss on my top 10 Tuesdays. So I'm going to do a top 10 Tuesday today and really focus on the front desk and billing office flows and workflows because they really have to be in sync. And if they're not in sync, I would say the majority of the time, then you're going to make some common mistakes. And I think sometimes the front desk gets the blame when maybe it's the billing office and vice versa. The billing office gets the blame when maybe it's the front desk, or I should say the people collecting the information. And so let's just take a look at some basics. Is sometimes you have to really get back to basics and understand what you need before you can move forward with what we do to, start the revenue cycle management process. And it really starts with the intake of the patient. So the first thing is a lot of the mistakes have to do with incorrect information. So it's important whether you are having patients go online to make an appointment or you're taking their information over the phone or they're texting or faxing it to you if you still use faxes. But the incorrect patient demographic information, name, date of birth, address, etc., is one of probably the biggest mistakes that happen quite a bit when trying to submit an insurance claim, just the demographics incorrect. The number two would be incorrect insurance information. So maybe the insurance has been terminated and it wasn't checked first. There could be an error in data entry, or you're using an old electronic mail address for that payer. Or one thing I've seen quite a bit, instead of actually sending it to the payer, you're sending it to maybe the plan administrator, which is incorrect. Sometimes you have to really search it out on the card, or maybe even the incorrect sequence for primary and secondary insurance. We still look at birth dates. We still look at who's working, who's not working. And so, just those two things between demographics for the patient and then incorrect insurance information can completely domino affect your billing and insurance department. And then the latest insurance card isn't scanned. Always really ask every time the patient comes in, especially those patients that are coming in maybe every 3 to 6 months or once a year, what's changed? What's updated? Do you have something new? And you need to verify it, which leads me to number 4, eligibility and benefits not verified for either that encounter or for the services, or understanding, the coverage for that patient. And a lot of times things are scheduled, things are planned, things are done without even getting, that information for eligibility. And you're wondering why you're getting any kind of denials, or the patient's getting these surprise bills. Patient out-of-pocket responsibility not collected at the time of service. Remember, patients should pay their copay on the way in, not on the way out. Because it's amazing, they lost their wallet or their purse or whatever from the time they were in the exam room to the time they hit the front desk on the way out. But on the way in, I know when I go to my doctor, and I have a very high copay of $50 to see a primary care doctor. My insurance pretty much sucks, but that's what it is in California. It's just terrible. But I have to pay it on the way in. And for those of you out there that like to pay cash, make sure you get a receipt and look at your receipt. It's happened to me before where I've paid cash. I've gotten my receipt. My receipt actually says 0, but I didn't notice it because I just folded it up and put it back in my purse. And now I pay by credit card. I'm like, know what? I need to have a record of that. So, and it could just be, a mistake at the front desk, but because cash is so easily stolen, you have to really be cautious for yourself. And then failing to obtain referrals for HMO policy. That's a really big deal. If you're going to you're a specialty practice and you're going to have a patient come in from a primary care practice, but they're an HMO referral, they have to have a referral with them. They have to have, an order from their main physician's office. That's why HMOs are less expensive to the patient, because their care is directed by their primary care office. And so I know I'm having issues with my shoulder. Don't get old, folks. Frozen shoulder is a thing. And so I had an x-ray taken, but it was crazy. I was in my primary care office. The doctor wrote it up. Then they had a print off in order for it. Then I had to have it verified when I went down to the x-ray department. So those are referrals are a really big deal, or you're not only going to get a denial, but the patient then will yell at you, which leads us to the next one, which is, number 7, no prior authorization for procedures. Now, prior authorizations, I know those are a pain. I wish that the federal government was going to be quicker to fix this problem, because they said, oh, we fixed it, we have all this stuff going on. A lot of this prior authorization issue, they don't take effect until 2026. And with the new policies that have been, or I should say the new policy platform that it looks like our new HHS director, Robert F. Kennedy Jr. is going to have, he actually has policiesforthepeople.com, and that's the first thing I put in there. You need to fast track prior authorizations and get this fixed, because patients are not getting the care they need, physicians are frustrated, and it's not fun in a physician's office to wait and wait and wait for prior authorizations. It's terrible. So hopefully they're listening to that. But failing to obtain referrals is a problem, and no prior authorization for procedures. And then one of the other ones that I think is really important is not scheduling follow-up appointments. When patients say, oh, look, I'll let you go, at least schedule one. At least try to get them scheduled, and then they can always change it. And say that to them. Say, well, why don't we put you on the books so that you have one, because we're booked, 2 months out, and then you have an appointment. And then it also helps so you don't have to deal with the, follow-ups and as far as recalls. And so try to get the patients that are scheduled while they're there, when they're checking out, that they can get an appointment when they're there. That's really just, it also shows medical necessity. So I was dealing with an audit for a payer recently, and they denied a lot of services for this really big company, this really big health company, and they basically said there's no medical necessity. You didn't even schedule follow-up appointments to make sure these patients had it. And so now they're not just looking at what you do today, they're looking at how you manage and follow up with that patient. I'm also seeing that could be a potential refund request for that complexity code, G2211. If you haven't established that longitudinal relationship, meaning that you're taking care and taking into account everything that goes on with the patient now and what you're going to manage in the future, but they don't have a follow-up appointment, it would be really tough to prove that. Also, I'm starting to see denials with transitional care management. They're saying, well, show us where you saw the patient in the hospital. Well, we didn't. Okay, so you just got a list and saying now you're going to take care of all the patient's needs when you didn't even have, that patient. You didn't see that patient before, and I don't see a follow-up appointment for the patient to come in. So the payers look at a lot of things when it comes to medical necessity, and it's not just about what you did today, it's what you are going to do to maintain that patient relationship. Another one would be, and this is number 9, regular data backups for patient information. Have you ever thought about that? Think about what happened with Change Healthcare. That was a problem. So that, we lost a lot of data, you lost a lot of time, you lost a lot of information, and a lot of information was patient data. So that has to be something you're thinking of now, and try not to, wait for another tragedy like Change Healthcare to really make that happen. So I mentioned specialty referrals. Remember, for example, if you're a podiatrist office and you have a patient that was referred for diabetic shoes, well, you have to have a written authorization or referral for that from the primary care office with that patient's, diabetic issues and peripheral neuropathy. So if you don't have that referral, you don't have, I don't want to say the right to order it, but you don't have an eligible patient for that order. That's the best way to put it. And then the last thing I'm going to say, and this is, really kind of number 10, even though I kind of fit in a couple of them in there, front desk training on digital forms. Make sure you're training your staff, not just on how your computer works, but how to fill out those forms. If, a patient is coming in and you're assisting them, or if they're in the exam room, maybe even back office staff, but if they're on the phone, say, oh, go to our website and do this. I would walk the patient through it. I see too many front desk staff being dismissive to patients, and just not understanding that not everybody is computer savvy. They don't always, a lot of patients, especially the elderly, haven't even opened a computer, or if they do, it hasn't happened in a long time. And if they do, it's only to play bingo or it's only to play a game. And so I'm just thinking of my, grandparents and parents when they were alive. And I just think that it was interesting that they are just looking at me like, computer, we don't have to do that back in my day. And so they prefer paper. So digital forms can be a challenge for elderly patients and patients who have just challenges writing or, seeing. I know a lot of times they said, okay, sign here. And I might have forgotten my reading glasses when I'm trying to sign something, so you can't see it. And just the dismissive attitude that I see a lot of times at that front desk is really causing me some distress. And I'm just taking this from a personal experience of going to the doctor lately myself. And then when I go into practices to assess and clean up either, front desk, revenue cycle management, shadow physician, whatever, I see it even more. And you need to not only empathize with the patient to understand that when they come in, let's say with a crutch, and you hand them a crutch and their papers in one hand, and you hand them, a clipboard, how do you think they're going to get back to their seat? So really, read the room, understand what patients' needs are, and to be the best person at not just in the front desk, but in the revenue cycle management, wherever that starts in your workflow, and most time it is at the front desk, make sure you're doing everything you can to start the process where not only do you have good information, it's effective, that everyone's trained, but that you're taking into account patients' maybe limitations when it comes to giving you good information. Help them out. Sit with them in the waiting room. Just go out and say, I'm going to help this patient because it looks like they could have a challenge. Or ask them at the front desk, do you need help filling out paperwork? I'm happy to come sit with you. And patients love that. Talk about having great surveys if that's something that you do. And I would really like to see more of that. So hopefully we see more of that in the future. But that's really what I wanted to talk to you today about. The Codecast podcast is also brought to you today by Just Coding. This is your continuing online education destination. Pay one price and earn dozens of AAPC, ACDIS, and AHEMA credits annually. Save 10% off a new subscription using coupon code SAVE10. Just visit justcoding.com to subscribe. And also, my new workbooks are on terryfletcher.net. And so make sure you check those out at our store. And also don't forget that I have my on-demand E&M services and telehealth. And boy, do we have a lot going on there. And all kinds of different things for 2025 on our website. And not to forget the Coding Corner membership. I know a lot of you have signed up recently. We are just exploding with members, especially executive members. We loved having you last week on our Ask Me Anything call, quarterly call. So for those of you that are needing ongoing help, ongoing question and answers, ongoing, compliance questions, ongoing help with appeals, check us out. Just take a look at terryfletcher.net, go to services, and underneath the very first drop down is the Coding Corner membership. So hopefully those of you that need that will join our service. We'd love to have you. And then just a personal tidbit this week. My Steelers are 7-2, just saying. Now we play the Ravens over the weekend. So actually I'm recording this prior to our game on Sunday. So you'll know if I'm going to be happy or sad come the following week. So hopefully it'll be a good thing and we'll go to 8-2. But if not, we've got a little cushion. So we'll see what happens. They bunched up all of our division games all at the end. So it's going to be a really tough last 8 weeks, but I'm here for it. So everyone, I hope you're really looking forward to Thanksgiving coming up and having a good fall. I know it's been a lot chillier here in California. I don't know what your weather looks like, but hopefully you're into sweater weather. I know I am, and having a really good November. So everyone, make it a great rest of your week. Make it a great day, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.